Every morning, millions of people reach into their medicine cabinet and swallow pills they believe are helping them. Pain relievers for that nagging headache, antacids for heartburn, blood pressure medications prescribed by their doctor. But what if I told you that some of the most common medications sitting in your bathroom right now could be silently affecting your kidneys with every dose you take? Your kidneys filter over 50 gallons of blood every single day, removing waste, balancing minerals, and keeping you alive. But these remarkable organs are also vulnerable to damage from medications that millions of people take without a second thought. The concerning truth is that medication-induced kidney damage, called nephrotoxicity, is one of the leading causes of acute kidney injury in hospitals and a significant contributor to chronic kidney disease. According to research published in the Clinical Journal of the American Society of Nephrology, medications account for approximately 20% of all cases of acute kidney failure in hospitalized patients. But here's what's even more concerning. Many of these kidney-affecting medications are available over the counter, sitting on pharmacy shelves where anyone can purchase them without understanding the potential risks. The most challenging aspect: kidney changes from medications often happen without obvious symptoms. No pain, no clear warning signs until significant changes have already occurred. You might feel perfectly fine while your kidney function quietly changes, filtration capacity slowly diminishes, and nephrons experience stress. In this video, I'm going to reveal 7 common medications that research shows may affect your kidneys. Some of these will surprise you because they're medications people take every single day. I'll explain exactly how each medication may affect kidney function, what symptoms to watch for, and most importantly, what alternatives you can discuss with your healthcare provider. But first, you need to understand why your kidneys require careful consideration when it comes to medications, because once you understand this concept, you'll approach medications more thoughtfully. Your kidneys are sophisticated filtration systems, and every medication you swallow must pass through them for processing and elimination. Think about that for a moment. Every single drug, every chemical compound, every active ingredient flows directly through the microscopic filters in your kidneys called nephrons. Each kidney contains approximately 1 million nephrons. These tiny structures are efficient at filtering waste, but they can be affected by various substances. When you take medications, especially in high doses or for extended periods, you're requiring your kidneys to process these chemicals repeatedly, day after day. Here's what makes this particularly important to understand. The kidneys receive about 20% of your heart's blood output with every beat. That means they're constantly exposed to whatever substances are circulating in your bloodstream, including medications, at concentrations higher than almost any other organ. This intense exposure makes your kidneys uniquely susceptible to medication effects. Some medications may affect kidneys by reducing blood flow to these organs. Others may cause direct effects on kidney cells. Still others might trigger inflammatory responses or cause crystals to form inside kidney tubules. The concerning aspect is that once nephrons are significantly damaged, they cannot regenerate. Unlike your liver, which has remarkable healing capacity, or your skin, which constantly renews itself, kidney tissue has limited regeneration ability. This is why prevention and early detection are so important. And here's the part that should concern everyone. You can experience kidney function changes before having any symptoms at all. Most people don't notice anything wrong until they've lost more than 50% of their kidney function. By the time symptoms appear, substantial changes may have already occurred. Now that you understand why kidneys require careful consideration, let's discuss the 7 common medications that research suggests pose risks. Number 1 might surprise you because it's probably in your medicine cabinet right now. Number 1, non-steroidal anti-inflammatory drugs, commonly called NSAIDs. This category includes ibuprofen, sold as Advil and Motrin, naproxen, sold as Aleve, and aspirin in higher doses. These are among the most commonly used over-the-counter medications worldwide. Americans alone consume billions of doses of NSAIDs annually. Here's why NSAIDs require careful consideration for kidney health. These medications work by blocking enzymes called CoX-1 and CoX-2, which produce compounds called prostaglandins. While blocking prostaglandins reduces pain and inflammation, it also affects your kidneys. Prostaglandins play an important role in maintaining blood flow to your kidneys, especially when you're dehydrated or your kidneys are under stress. When you take NSAIDs, you block prostaglandin production, which may cause blood vessels leading to your kidneys to constrict. This reduces blood flow, potentially affecting kidney tissue. Research published in the American Journal of Medicine found that regular NSAID use is associated with increased risk of kidney concerns. I remember working with a patient named Thomas, a 68-year-old man who had been taking ibuprofen daily for knee pain. During a hot summer when he wasn't drinking enough water, he developed acute kidney changes within days. His creatinine jumped significantly, requiring hospitalization. The risk increases if you're already in a higher risk category. If you're over 60, have diabetes, have high blood pressure, are dehydrated, or already have any kidney concerns, NSAIDs require even more caution. What makes this particularly concerning is that many products contain NSAIDs, cold medications, menstrual pain relievers, migraine formulas. Many contain ibuprofen or naproxen. People may be taking multiple NSAID-containing products without realizing it. So what's the alternative? For occasional pain, acetaminophen, sold as Tylenol, is generally considered safer for kidneys when used at recommended doses, though it has its own considerations for liver health. For chronic pain, discuss non-medication approaches with your healthcare provider. Physical therapy, heat or cold therapy, weight management, and other pain management strategies. But NSAIDs aren't the only common medications affecting kidneys. Number 2 is a class of drugs that millions take daily for a very common condition. Number 2, proton pump inhibitors, commonly called PPIs. These medications include omeprazole, sold as Prilosec, esomeprazole, sold as Nexium, lansoprazole, sold as Prevacid, and pantoprazole, sold as Protonix. Doctors prescribe PPIs to reduce stomach acid for conditions like gastroesophageal reflux disease and to treat stomach ulcers. PPIs have become incredibly popular, with over 100 million prescriptions written annually in the United States alone. Many are available over the counter, which has led people to assume they're completely safe for long-term use. But research over the past decade has revealed concerning connections between PPI use and kidney health. Multiple large studies have found that PPI use is associated with increased risk of both acute kidney injury and chronic kidney disease. A landmark study published in JAMA Internal Medicine followed more than 10,000 people and found that those taking PPIs had a 20 to 50% increased risk of developing chronic kidney disease compared to people not taking these medications. The risk increased with longer duration of use. The mechanism is still being researched, but scientists believe PPIs may cause a type of kidney inflammation called acute interstitial nephritis. What makes this particularly challenging is that this condition often doesn't cause obvious symptoms in early stages. By the time it's detected, changes may have already occurred. I worked with a patient named Margaret, a 72-year-old woman who had been taking omeprazole daily for 8 years for reflux. She felt fine until routine blood work showed her kidney function had declined. Her creatinine had risen significantly. When we stopped the PPI and addressed her reflux with alternative approaches, her kidney function stabilized, but previous changes were permanent. What's particularly concerning is that many people take PPIs far longer than necessary. These medications were originally designed for short-term use, typically 8 to 12 weeks. But people often continue indefinitely, sometimes for years. If you're taking a PPI, don't stop abruptly without medical guidance, as this can cause rebound acid production. Instead, work with your healthcare provider to explore alternatives. For some people, lifestyle modifications can reduce reflux, eating smaller meals, avoiding trigger foods, not lying down after eating, elevating the head of the bed. H2 blockers like famotidine may be alternatives for some people, though they're less powerful than PPIs. Number 3, certain blood pressure medications, specifically ACE inhibitors and ARBs. Now, this requires careful explanation because these medications are often prescribed to protect kidneys in people with diabetes or existing kidney disease. The relationship is complex and depends on individual circumstances. ACE inhibitors include medications like lisinopril, enalapril, and ramipril. ARBs include losartan, valsartan, and irbesartan. These medications work by affecting the renin-angiotensin-aldosterone system, which regulates blood pressure and fluid balance. Here's where it gets nuanced. For many people, especially those with diabetes or protein in their urine, these medications actually protect kidneys by reducing pressure in the kidney's filtering units. They're considered important therapy for kidney protection in these situations. However, in certain circumstances, these medications can cause acute kidney injury. This typically happens when someone becomes dehydrated, develops an infection, or takes them in combination with other medications like NSAIDs or diuretics. In these situations, ACE inhibitors and ARBs can reduce blood flow to the kidneys significantly. The classic concerning scenario involves what doctors call the triple whammy. Someone taking an ACE inhibitor or ARB for blood pressure, a diuretic for fluid retention, and an NSAID for pain. Add dehydration, and you have a perfect storm for acute kidney problems. Research published in the BMJ found that this combination increases risk of acute kidney injury by 31%. I remember a patient named Robert, a 65-year-old man taking lisinopril for blood pressure and a diuretic. During a heat wave, he became dehydrated and took ibuprofen for back pain. Within 48 hours, he was in the emergency room with acute kidney injury. The key with these medications is appropriate monitoring and awareness. If you're taking an ACE inhibitor or ARB, your healthcare provider should check your kidney function regularly. You should be educated about situations that increase risk. Dehydration from illness or heat, starting NSAIDs, or undergoing certain medical procedures. In these situations, your doctor may temporarily hold these medications. Never stop these medications on your own, as doing so could cause dangerous blood pressure spikes or worsen underlying conditions. The decision should always be made in consultation with your healthcare provider based on your individual situation. Number 4, certain antibiotics. Several commonly prescribed antibiotics can affect kidneys, particularly when used in high doses for prolonged periods, or in people with existing kidney concerns. The antibiotics most associated with kidney effects include aminoglycosides like gentamicin and tobramycin, vancomycin used for resistant infections, and even some common antibiotics. Aminoglycosides are particularly concerning. These powerful antibiotics are effective against certain bacteria, but they can directly affect kidney tubule cells. Research shows that approximately 10 to 20% of patients receiving aminoglycosides develop some degree of kidney changes. The kidney effects from aminoglycosides typically appear after several days of treatment. Initially, people may notice no symptoms at all. The first sign is usually an increase in creatinine levels detected on blood work. The good news is that if caught early and the medication is stopped, kidney function often recovers, though not always completely. Vancomycin can also affect kidneys, especially when used in high doses or combined with other medications that affect kidney function. The risk increases when vancomycin is used together with aminoglycosides or NSAIDs. I worked with a patient named Lisa, a 54-year-old woman who developed a severe infection and was prescribed antibiotics including gentamicin. After 5 days, routine lab work showed her creatinine had risen significantly. We immediately stopped the gentamicin and switched to alternative antibiotics. Her kidney function gradually recovered, but she was left with mild chronic kidney disease. What can you do to protect yourself? When prescribed antibiotics, especially powerful ones for serious infections, ask your healthcare provider about kidney monitoring. If you have existing kidney concerns or risk factors, make sure your doctor knows this, as doses may need adjustment. Stay well hydrated during antibiotic treatment unless your doctor advises otherwise. Number 5, contrast dye used in medical imaging. Contrast media, also called radiocontrast, is used in CT scans, angiograms, and certain imaging procedures to make blood vessels and organs more visible. While these imaging tests provide crucial diagnostic information, the contrast dye can cause a condition called contrast-induced nephropathy, a form of acute kidney injury. Contrast-induced nephropathy occurs in approximately 2 to 7% of the general population receiving contrast, but the risk increases significantly in people with existing kidney disease. For patients with chronic kidney disease, the risk can be much higher. The mechanism involves multiple factors. Contrast dye may cause constriction of blood vessels in the kidneys, reducing blood flow. The dye can also directly affect kidney tubule cells. The combination creates significant stress on kidney function. The changes typically appear within 24 to 48 hours after contrast exposure. Creatinine levels begin rising, peaking around 3 to 5 days after the procedure. In mild cases, kidney function gradually returns to baseline. In more concerning cases, Particularly in people with pre-existing kidney disease, changes can be more persistent. Several factors increase risk: existing chronic kidney disease, diabetes, dehydration, heart failure, advanced age over 75, and concurrent use of other medications that affect kidneys. The amount of contrast dye used also matters. I remember a patient named William, a 78-year-old man with diabetes and mild chronic kidney disease, who underwent a CT scan with contrast. Despite receiving intravenous fluids before and after, his creatinine rose significantly. He required intensive hydration therapy, and while his kidney function eventually improved, it never quite returned to his previous baseline. Protection strategies include careful assessment before any contrast procedure. Your healthcare provider should check your kidney function beforehand. If you have kidney concerns, your doctor should consider whether a non-contrast imaging test might provide adequate information. If contrast is necessary, strategies include using the minimum amount needed, ensuring adequate hydration, and temporarily stopping certain medications. Number 6, certain diabetes medications. This requires nuanced discussion because many diabetes medications actually protect kidneys, and uncontrolled diabetes itself is one of the leading causes of kidney failure. SGLT2 inhibitors include medications like canagliflozin, dapagliflozin, and empagliflozin. While large studies have shown these medications can slow progression of kidney disease in people with diabetes, they can occasionally cause acute kidney injury, particularly in situations involving dehydration or severe illness. The mechanism involves volume changes. By causing glucose elimination in urine, SGLT2 inhibitors lead to increased urination and fluid loss. In someone already dehydrated or acutely ill, this additional fluid loss can reduce blood flow to kidneys enough to cause injury. Metformin, the most commonly prescribed diabetes medication, is generally very safe for kidneys. However, in people with significantly reduced kidney function, metformin can accumulate to concerning levels. For this reason, metformin must be dose adjusted or avoided in people with advanced kidney disease. I worked with a patient named Patricia, a 66-year-old woman with diabetes taking an SGLT2 inhibitor. During gastroenteritis with dehydration, she continued taking her medication. Within 2 days, she developed acute kidney injury. We stopped the medication, provided aggressive hydration, and her kidney function gradually recovered. The key is education and monitoring. If you're taking an SGLT2 inhibitor, maintain good hydration and know to temporarily stop the medication during acute illnesses involving dehydration. If you're taking metformin, your kidney function should be checked regularly. Number 7, lithium, used primarily to treat bipolar disorder. Lithium is highly effective for managing bipolar disorder, but long-term use carries kidney risks. Research indicates that approximately 20% of patients on long-term lithium therapy develop chronic kidney disease. Lithium can cause several types of kidney effects. It can impair the kidney's ability to concentrate urine, leading to a condition where people produce large volumes of dilute urine. More seriously, lithium can cause chronic inflammation affecting kidney tubules. Over years, this can progress to chronic kidney disease. The kidney effects from lithium are often related to both dose and duration of treatment. Higher lithium blood levels and longer treatment increase risk. Research found that risk of chronic kidney disease in lithium users increases by approximately 6% per year of treatment. I remember working with a patient named David, a 52-year-old man who had been taking lithium for 18 years. Routine monitoring revealed his kidney function had gradually declined. We had to work carefully with this psychiatrist to transition him to alternative mood stabilizers. If you're taking lithium, regular monitoring is essential. Your healthcare provider should check lithium blood levels regularly and kidney function at least annually. Stay well hydrated, as dehydration increases lithium levels and kidney injury risk. Be aware of drug interactions with NSAIDs, ACE inhibitors, and diuretics. Now that you know the 7 common medications that may affect kidneys, you might be feeling concerned. But knowledge empowers you to have informed conversations with your healthcare providers and take proactive steps. The most important thing to understand is that this information isn't meant to frighten you into stopping medications without medical guidance. Many of these medications, when used appropriately and with proper monitoring, provide benefits that outweigh their risks. The goal is informed decision-making and appropriate precautions. Here are key protective strategies. First, always inform every healthcare provider about all medications you're taking, including over-the-counter drugs. Second, maintain a complete medication list. Third, ask questions before starting any new medication. What is this for? Are there alternatives? What are the kidney-related risks? How will my kidney function be monitored? Fourth, never take medications longer or in higher doses than recommended without medical guidance. Fifth, stay well hydrated unless your health care provider advises fluid restriction. Sixth, avoid combining multiple medications that affect kidneys whenever possible. Seventh, know your baseline kidney function. Ask your healthcare provider for your creatinine and estimated GFR numbers. Eighth, advocate for regular monitoring. If you're taking medications known to affect kidneys, request periodic kidney function testing. Ninth, be vigilant during illness. Dehydration increases risk of kidney injury from many medications. 10th, before any procedure using contrast dye, make sure all healthcare providers know about your kidney function and medications. Remember that your kidneys have capacity to maintain function when given proper care. If medication-related kidney changes are caught early and addressed promptly, function often improves or stabilizes. The key is awareness, vigilance, and open communication with your healthcare team. If you found this information valuable, share it with family and friends. Kidney effects from medications are largely preventable with awareness and appropriate precautions. Subscribe for more evidence-based health information. Your kidneys perform vital functions every day. They deserve your attention and protection. By understanding which medications pose risks and taking appropriate precautions, you can protect these vital organs while still benefiting from necessary treatments. Thank you for watching. Stay informed, ask questions, and always advocate for your kidney health. Remember, you are your own best health advocate. Always consult with your healthcare provider before making any changes to your medications. Take care of your kidneys, and they'll take care of you.